Diabetes is invading their communities and experts are taking the bull by the horns. The Central Brooklyn Diabetes Task Force brought together a panel of experts on Saturday at Thomas Jefferson High School in East New York to provide the tools and information to equip the task force members to wage a successful war against the diabetes epidemic.
We have mapped out 3 geographic areas in central Brooklyn. First, we call the island of Flatbush, which is the largest concentration of Caribbean people anywhere in America outside of the Caribbean, and the village of Bed-Stuy, Bushwick, and finally, we are here in the town of East New York, Brownsville.
East New York Brownsville is one of the 2 most hit areas in the country.
Diabetes is a major crisis. It's an epidemic proportion in New York City. And the 2 areas that are the largest concentration of diabetics, not only in the state of New York, but in the entire region, or maybe the entire country, is South Bronx, Brownsville, East New York, Central Brooklyn.
The conference began with a health expo that included health exams, glucose testing, and various screenings.
There's a lot of amputation that goes along with having diabetes for too long, so a lot of these people can't service themselves like they used to. So I think this conference is great, it's informative, and it allows people to understand AC1 levels, type 2 diabetes, some of the challenges with food preparation, your diet that's consistent with diabetes, so it's great.
They might not even know that certain things are problems, and so you can come to these health fairs. Again, people can answer questions for you.
It's a big concern, unfortunately. We need to be more aware, and the numbers are just getting higher and higher. The proportions, it's getting out of hand. So we need to take control now.
Also displayed at the expo was a diabetes tracking device called Pallet.
Pallet is a dietary tracking tool with application on your mobile phone along with the hardware, just like this. And you can put it in front of you on the dining table. That will help you to track your meal. And the app itself has a function to track your blood sugar level, your exercise, your stress level, sleep, all in one place. More importantly, our program connects you with a lifestyle coach. So we have lifestyle coach with monitoring every step of the way to make sure that you stay on track to manage either pre-diabetes, weight loss program, and a diabetes program.
Under the theme, Let's Beat Diabetes Forever, the panel members, made up of doctors and health professionals, made it clear that diabetes is an epidemic in the community and they need to tackle it together.
Plant-based nutrition, which emphasizes vegetables, whole grains, nuts, seeds, legumes, and fruits, can prevent, treat, or reverse certain chronic diseases in adults. 91% reduced risk of getting diabetes if you happen to have a diet high in fiber with a lower glycemic index. We'll talk about that.
Definitely, if you have any complication of diabetes, like kidney complications, eye complications, younger than age 50, you should definitely get this checked out because, like I said, a lot of those, when you're thinking of the kidneys or the eyes, you're not thinking blood vessels because you're thinking of the actual organ, but all of those are caused because there's already some problem in the blood vessel. So if you're younger than 50 but you have another complication of diabetes, you should definitely get that test, and it's called an ankle brachial index, ABI.
There is a difference between pre-diabetes and diabetes, right, when we diagnose it based on your sugar levels or A1C levels. But again, here you see that New York City has a much higher rate overall compared to the national average of 9%.
Central Brooklyn had the higher cases of diabetes, but it's like that for every health outcome when you think about it. Central Brooklyn had higher cases of everything: diabetes, HIV, cardiovascular disease, asthma. You think about it.
According to the New York City Department of Health and Mental Hygiene Community Health Profiles, 12% of adults in central Brooklyn have diabetes compared to 9% in New York City overall. Participants say they learned a lot that they would use to raise awareness about diabetes in their community.
I learned various things of how to eat, how to protect yourself, and not just protect yourself, but to learn the different ways of managing it, your health and other conditions. I have a family member that's diabetes, juvenile, and so I wanted to gain more information for myself and bring back to others that was not able to come.
It's very serious. We know that there are those that it's affecting vision, it's affecting their mobility, and folks not being able to afford the medication, of course, and diabetes affects the heart, it affects the brain.
The next Diabetes Expo and Conference will take place at the Brooklyn Museum on June 14, 2020. From East New York, Brooklyn, Florence Mafomeme.